This conference is co-sponsored by Johnson County Community College and the Center for Global Peace Journalism at Park University. My name's Louis Duguid. I was a longtime journalist with the Kansas City Star, and now I'm an author, lecturer, freelance writer, and political action committee chair for the National Association for Multicultural Education. Today, I'm your moderator. Here's a bit of housekeeping. We are recording the session, so if you have concerns about that, please take the appropriate steps, such as turning off your video. For our program, if you have any questions for our presenters, please put them in the chat box at the bottom of your screen. I will share your questions with her when her presentation is done. The presenter will provide time to answer your questions. Our 2020 Greater Kansas City Peacebuilding Conference began in September, examining the mainstream media's influence on peacebuilding and social justice. In October, the conference focused on colonial history in such places as Afghanistan, Pakistan, and India, with efforts of Mahatma Gandhi and others toward winning freedom and peace, followed by today's societal and diplomatic outreach promoting social justice and peace. On November 4, two presentations addressed peace and efforts to care for the underserved people in this community, as well as the Poor People's Campaign, a comprehensive and effective approach to Black Lives Matter and addressing the needs of all marginalized communities. This morning, we heard about the pathology of American racism in the new millennium. If you missed the earlier programs, I encourage you to Google the 2020 Greater Kansas City Peacebuilding Conference to view recordings of those sessions, which have been posted in the chat box at jccc.edu/conferences/peacebuilding. Our second speaker today is Kansas City Councilwoman Melissa Robinson. She also is president of the Black Healthcare Coalition. A few of you may remember her voice from more than a couple of decades ago on KPRS FM radio as she started her community service career at a very young age with the ad hoc group Against Crime, where she worked as director of crisis intervention, assisting families in navigating the region's social service and criminal justice systems. Before joining the Kansas City Council, Ms. Robinson was elected to the school board of the Kansas City Public Schools and served as its president. You will find more about the speaker and her educational background on the Greater Kansas City Peacebuilding Conference website. Please welcome Ms. Melissa Robinson, who will speak with you today on economic mobility, a framework to achieve health parity.
Wonderful. Thank you so much, Mr. Duguid. I appreciate the opportunity to be here with you today. Thank you for inviting me. Today is Thursday, Fast and Furious Day at 414 East 12th Street here at the City of Kansas City, as it's our legislative day, but I could not miss this opportunity to be with you as I am a true believer in reconciliation, and I'm a true believer that this is the very work that we need to be doing in order to achieve racial reconciliation within our city and within our region. Parity is not a word that we hear very often. Oftentimes we talk about equity. So for the purposes of this presentation, I really want you to think about health equity and equity in general as a lens. It's a tool that we utilize in order to achieve parity. It's a tool that we utilize to be able to whether we need to scalpel it out or whether we need to use a sledgehammer as it relates to eliminating inequities. And so let's always remember that parity is our goal and equity is an application. So the Black Healthcare Coalition, we exist to eliminate health inequities. And We've been around in the greater Kansas City area for 31 years. I've been with the agency for 11 years. Our theory of change is rooted in three basic action steps, and that is around healthcare access, ensuring everyone, we believe that healthcare is a basic human right, and people should have access to culturally responsive healthcare whenever they need it. And we also believe in health advocacy as well as health promotion. We have a people-centered advocacy agenda that you can find on our website, in which we worked at a grassroots level, walking door to door with individuals, talking about if we want to achieve health parity and eliminate health inequities, what is it that we need to be working on? And so when you see our agenda, it's not rooted in things like attacking the healthcare system. It is very much rooted in economic mobility, which we'll talk more about later. Health promotion is also something that we work a lot on, recognizing that that there is internalized oppression and how we have, as a people, as African Americans, have internalized oppression and how that shows up in our health behaviors and what do we do to interrupt those things. I am also a member of the City Council for the City of Kansas City. And there are some theories of change that I have as it relates to representing the city's 3rd district. Our district spans from about Brush Creek Boulevard to Independence Avenue on the north, Truce on the west, and the Chief Stadium, if you will, as a landmark on the east. So we're a pretty large landmass. That's in part because my district has the lowest census numbers as well, which impacts redistricting and the broad span that we have. And so we're focused on housing and addressing gentrification in housing in certain parts of our neighborhood and making sure that we have sustainable housing. When you look at the Mid-America Regional Council that does a lot of projecting and forecasting, the 3rd district stands to lose over 10,000 rooftops in the next 20 years. And so we have to do some very dramatic changes in order to prevent that from happening. Economic mobility and economic development, in which we'll talk more about throughout this presentation as well, are some things that we're working on. So I was elected and sworn in on August the 1st of 2019. And on August the 29th of 2019, I passed unanimously a measure to really identify racism as a public health crisis. And this aims to address the root causes of health inequities. So we'll talk more about what the resolution actually entails. So resolution 190679, you can find the full resolution on our city clerk's website, and just punching in those 6 numbers, it will come up. But it talks about the connection regarding economic disparities, education and jobs disparities, and how that all connects to health disparities. And so when you think about the 3rd district, for example, which is our most Blackest district, if you will, it has the most concentrated poverty. It has the most aging housing infrastructure. It has the highest number of unemployment. So there's some critical challenges that exist within the 3rd district, but a lot of the disparities are connected to, what are African American and Latino people of color, how are we building those pipelines as it relates to making sure that they're participating in the healthy economy, and how they're participating in economies that are not the underground economy, if you will. And so with the resolution, we called out all of the different health inequities that exist, whether it's around obesity, diabetes, PTSD, depression, substance abuse, and the like. These are some just foundational things that were also mentioned within the resolution, and that are grounding. Many of you may already know these definitions, but we had to start from a place of education and letting people know that there is no scientific base as it relates to race and how we fit on the social strata, if you will. And we were able to delineate and help folks understand racism and systemic racism. And so one of the when we talk about systemic racism, one of the examples that I use is one that's very dear to my heart. My children, I live in the 3rd district. My children are attending school at home virtually, and there was a shooting in front of my home, and their caretaker, went outside, and this was somebody who came to our home, pulled up in our driveways, and started shooting and started calling out for someone to come out of some house within our neighborhood. The person that they were calling for doesn't live in our house, but they were just shooting over and over and over again, 8 or 9 times, and their caretaker risked their life to go and get their license plates, to take pictures of the person with their gun in the hand and all of that. And when the police came, they said, there's really nothing we can do. Yes, there's an ordinance against celebratory fire. And it's like, no, this isn't celebratory fire. This person was looking for someone. But when you think about systemic racism and what's happening in the 3rd district, that is something that would never be allowed in other parts of our city. If someone were to come and to terrorize other parts of our city, that person would be apprehended. They actually found the person because they had the license plates tags, but they said, we followed them for a little while, and we put our lights on. So typically they know that we're kind of on to them, so they don't necessarily come back. So you should feel good about that. Well, that's an example of systemic racism, because again, deep rooted within that policing system and that within that structure, there's a disadvantage that my family has based off of where we live. And so also breaking down the components of institutionalized racism and how that is pervasive and how it comes up and shows its head within a lot of different institutions, the healthcare system. Oftentimes we think about pain and how African Americans are treated for pain and are oftentimes looked at as drug seekers, that African Americans have higher tolerances of pain, and so we don't need certain levels of relief and prescriptions that other people need. And so those are some institutional racism things that come up within a lot of the different places that we have to interact with. And racism and health, there's over 100 studies that really link systemic racism to negative health outcomes. When you think about infant mortality in the Black community and maternity mortality within the Black community, where you're able to look at and see that if you're a Black woman who has a college degree, you have poor or worser health outcomes than a white woman with a high school diploma. And so it talks about, a lot of these studies talk about the weathering effect and how as African Americans, the more you are having to work within these institutions and experience racism in housing, in education, in employment, in transportation, there's a weathering effect that doesn't allow for you to have a positive birthing experience. And then economic racism that when you think about, again, the boundaries of the 3rd district and how there's been, we just didn't wake up and say, oh, we have this proliferation of tobacco and alcohol sales and blight and abandoned housing and evictions. This was done strategically through redlining and a lot of policies. in strategic disinvestment. And that's why when we think about the GO bonds, for example, that we all voted on, of dollars that go within the, that are spent within the community, we're always looking at how do we apply the lens of equity through that spending so that we can achieve parity, right? All right, so 190679, it aimed for action. Yes, we had all of this conversation. We broke down some things that people needed to be either reminded of or connected to or aware of, but it really required our city manager to do a comprehensive assessment of our policies that we have within our system, as well as um, either when we either pass or not pass a policy within the city, there's a checkbox that says, you know, is it good for the children? There's a fiscal analysis. There's a certain level of analysis that we have to do in order to say whether or not we're going to move forward. Well, this aims for a way in which, a process in which we can evaluate every policy from a lens of racial equity. And going from an assertion to practice, ensuring that we're strategically incorporating equity and inclusion within our organizational practices as a city. So the economics of health equity as it relates to economic mobility. These are some things, and I'm going to get into, these are some things that we're working on from an idea perspective. And then I also want to talk about some policy pieces that we're working on as well within the city to address economic disparities. And so we're working to ensure that every graduating high school senior, especially those that attend high school within areas where there's a high level of homicide, that they have access to a living wage job. If they're not going to the military, if they're not going to Johnson County Community College or William Jewell, or if they're not going to college, we want to make sure that there's a job placement for them, in which we start with the schools right around March to begin to identify those young people and start to match them up with employers, and making sure that they're ready to, when May comes, that they're ready to do that. And so obviously there's a lot of employment opportunities within the transportation industry, which within the construction industry, and within other industries, but they have to be living wage employment to ensure the idea that this person will need that employment to be able to take care of themselves and not an after school job, if you will. We have a target to work with this year 6 businesses within the 3rd district for scalability. And these are small businesses like, if you've not been to M&M Bakery, I would encourage you to go. It's one of the best sandwich shops within the city. And so working with some of those small businesses and ensuring that they have scalability, that they are bankable. The city has specific levers. There's banks that we do a lot of business with, and ensuring that they're doing what they're supposed to be doing, whether it's related to the CRA, or whether it's just being a good steward, being a good corporate citizen, and working and making sure that individuals that own businesses don't have to go through predatory lending types of situations in order to keep their businesses afloat. Especially in the era of COVID, the city passed revenue and resources for businesses, and we wanted to make sure, like as we were doing just phone calls to people in late March during COVID, we checked on our businesses. We talked about what support that they needed, how we can make sure that they're thriving through COVID, that they're sustaining their business through COVID. And then real estate development is key as well. If you don't know, about a year, 18 months ago, the city passed an initiative to, which I call it kind of our reparations, because It's about $10 million that goes within the east side of Kansas City for economic development opportunities to help to reverse some of the disinvestment. It's called the Central City Economic Development Sales Tax. It's a 1/8 cents of a sales tax. However, how do we begin to bootstrap, if you will, small real estate developers and making sure that they have a one-stop shop? There's a lot of economic development incentives that are available, but you have to stack those incentives in order to make it economically feasible to do the job. Land evaluation in the third district is much lower than other parts of the city. So when you go to a bank for that private equity to do your development, you're already upside down, if you will, because the land evaluation is low. What can the city do to address that from an economic standpoint? We can put infrastructure dollars within the project to help to remediate the blight so that the land evaluation comes up more. Or we can balance out that capital stack that the developer has with public infrastructure and public investment within that project. Accelerating attainable housing with the 1/8 cent sales tax is something that I am tremendously in support of and working on, just based on what I shared with you with the Mid-America Regional Council assessment. And then public policy is critical. There are certain policies that are in place, specifically the ones that I've referenced here are policies that are at the state level that we need to look at. Did you not know, and this is specifically, when we talk about the community colleges in Missouri, the 529 plans 5 or 6 years ago, with the 529 plans, I'm going to talk about the A+ program, which is connected to the community colleges in a second. But with 529 plans, the Black Healthcare Coalition, we worked with new families through our infant mortality program and set up 529 plans. Because research shows in which when we developed our advocacy agenda, the residents did a lot of research around what should be on our advocacy agenda. And one of the things was aggressively marketing 529 plans to the urban core because people don't know about them. And then also the research shows that a kid is 7 times more likely to go to college, whether it's $100 in the savings plan, $1,000 or $100,000. But the idea that someone's saving for them to go to college is an automatic expectation. That's something that I'm going to do. And so what we did is we worked with local banks to help to set up these 529 plans for the families once they went through some budget training, some just basic training around, how to own a house and things of that nature. And several of our families were kicked off and denied their public assistance because the 529 money that they had set aside for their child was considered savings, and they couldn't have the savings and then also get public benefits and public subsidies. So that's a public policy that we're working to help to address. The other thing with the A+ program, we went from about a 20% participation at Central High School in the A+ program to, I think it was, I don't want to say 2%, but it was definitely less than 10%. I don't know the exact number, but we had a dramatic reduction when the state decided to put on additional barriers for testing around math in order to be able to access the A+ program. It also tremendously impacted African American students and low income students in which they no longer had access to this free funding for college. I think that this is an advocacy issue that certainly should mean a lot to local community colleges, as it's a direct investment in their institutions for these young people to receive that free education. So that's another policy that we're working on, is to remove the administrative requirement for you to be able to test in to get the 529 plan. In the interim, we do a lot of support and help with the young people to making sure that they're able to pass those standardized tests. And then with the Central City Economic Development Sales Tax, there is a retail ban with that. So although we have the $7 to $10 million that's going within to this community, you cannot use it for retail unless it's in a historic district. And our historic districts are the 18th and Vine District and also the Santa Fe Neighborhood Association are historic districts. That's great. However, how are you going to create economic mobility if the dollar cannot flow through the community several times? And it's not able to do that if you have a retail ban on utilizing the funds. And so we're working with the Chamber of Commerce to put that on their advocacy agenda to exempt the Central City Economic Development sales tax from those retail bans so that we can utilize those funds so that dollars can flow more concentrated in the third district. Some other things that I'm working on as it relates to economic mobility, and then I'm gonna try to take questions for 30 minutes because I've been talking for quite some time. But one of the things is if you have a contract that is over $400,000 with the city, we're requiring you to collect data around who you're employing. And you have to keep that data, especially construction contracts and any procurement contracts around who you're employing from the third district and the fifth district are most vulnerable districts as it relates to economic mobility, so that we can have a foundation that, again, when you look at the definition that I shared with you earlier, it's about who has access to what, right? And so why is it that these individuals that live within these communities don't have access to taxpayer dollars that are going to these corporations to help make our city better? So I was able to pass a resolution regarding requiring our staff to collect those dollars. The other thing is a year-round internship program for young people, and those internships being paid. When we looked at our summer internship programs that we have called Hire KC, less than 20% were coming from the third district. But the third district has the most homicides. We know that the direct correlation between homicides is education and employment. So how do we reverse those things? I was successful in getting automatic bulky item pickup within 1 mile of the schools, the K-12 schools in the third district and fifth district, so that when we have those set outs, that kids don't have to walk to school with all of those bulky items and trash and illegal dumping within the community. And then finally, I did introduce a pretty broad sweeping policy around economic development incentive reform. It has not passed. It's on life support, but it's 200,497 is the number, 200,497 on our city clerk's website. The final hearing is next week, but the idea is that economic development incentives were created to address blight and not buildings on the plaza. And not, yes, our downtown had its renaissance, it has a renaissance, and we need to keep growing our downtown. However, our Kansas City public school systems, just wait for it, put your seatbelt on, loses $30 million a year because of tax redirections and tax abatements. $30 million a year. And so when you look at that disparity, that's economic violence on a community. When you take $30 million a year from its educational system and provide that for developers that refuse to develop in the neighborhoods in which these kids live. So I developed a righteous agenda. And so a lot of these things that I talked about are on that righteous agenda that we're trying to work on here at the city. And so IS 101, thank you all for listening. And I do would love to take any questions that you have. And you can always email me. I try to put out a blog every now and then, so that's on my website. And I try to respond on Twitter too, but yes.
Melissa, you provided us with a lot of great information, and yes, we do have questions. So hold on to your seatbelt. Do you want to free up the screen so that we can see more people?
Yes.
Okay, fantastic. Um, I guess one of the first questions is you mentioned reparations in Kansas City, and I guess I want you to explain a little bit about that. And can reparations here actually be a reality?
Well, I think that individual reparations from a federal level is something that's being explored, right? And I'm in support of that for descendants of slaves. Um, when I am a believer that you use what you have in order to achieve the things that you need to achieve. And so we were able to, with this 1/8 cent sales tax, it's a 10-year tax, it has a sunset. So why is it that we're not utilizing those funds as our quote unquote reparations in terms of making sure that we're remediating the blight and addressing the disinvestment, the decades and decades of disinvestment in the third district and in parts of the fifth district? And so this is our opportunity to uh, be able to use what we have in our hand to do the most good with that.
Okay. Now, you also talked about disrupting internalized oppression. Can you explain that, particularly as it relates to African Americans?
Yeah, absolutely. And so a lot of the choices that we make and a lot of the things that we look at are based off of how we're situated and again around what we call the built environment. So access to grocery, fresh grocery, and things of that nature, walking trails. But again, what are the thoughts that we're having that are keeping us held back, if you will? So yes, we have to address the built environment, but we also have to address the behaviors that we have as well that put us in a situation of chronic stress and things of that nature. I gave a presentation to a group of young children, young girls, in one of our area middle schools, and this was before COVID. But I opened it up at the end of the presentation, kind of like now, and the young lady said, well, I said, just ask me whatever you want to ask me. She said, like, how do I know how much money that I have on my EBT card? Because it's so embarrassing when we go to the store and we don't have enough money on the EBT card. And I said, well, I'm not quite sure, but there might be a number on the back of the card, like most credit cards. And the young ladies were like, wait a minute, you don't have food stamps? And I said, well, no, I don't. And um, all of them in the audience thought that that was the public subsidy is something that everyone has. And they also talked about having children when they turn 18, and being taught to have children when they turn 18 so that they can have multiple streams of income and that they could go and get a house on Section 8. So when you think about internalized oppression, these are real conversations that we're having with young people to say, no, food stamps is there for people who have hardships, and we're glad that it is there, but that's not an automatic that you don't. There are other things that you can do to contribute, and so that's one example of how we interrupt those cycles of poverty and violence in the mindset.
Okay. You mentioned a resolution that the council passed during your term that has an effect on city policy, looking through the lens of race. And I guess I wonder why that's not gotten a lot of press, how this resolution is supposed to have an effect on all of these other things that the city government is to do, but we don't know about it.
Yes, and I think that that is, part of my Baptist upbringing. I'm humble. I don't try to wave a flag and say, "Hey, we're doing this." And so that's something that we can do a better job at of uplifting that voice for internally and putting out press releases and having conversations like this and inviting the press in to having those conversations. But we introduced this before the George Floyd, incident. And so had this been introduced, coupled with a lot of the civil unrest that was happening locally and nationally, perhaps it would have gotten a lot of more attention.
Okay, I want to also enlarge a point that you made on the M&M Bakery. That's at 31st and Bruce, and just a bit east of Bruce Watkins Parkway for people who want to go there. It is run by African Americans. She's absolutely right. It has great food, and it's a good community meeting place. Did I cover the waterfront there, Melissa?
Yes, you did. And they do have a to-go window. You just step up and, grab your sandwich during COVID. Yes.
And for a
And
little
they have,
history about that place, it was actually originally started by a woman who's a Holocaust survivor. And
hmm,
then an African American bought the place and continued to run it. And until her death, the woman who had the place used to go there and actually enjoy the food too.
yeah.
Um, Now, you mentioned the trust, and I guess trust is a huge part of this when it comes to healthcare for African Americans. And why isn't that trust there, and what can be done to build the trust in the healthcare system?
Well, and I do think that when I go and sit in on a lot of the classes that our emerging doctors, our medical students are participating in locally, I think it does start with that level of education and that level of application as well when they're out doing their community clinics and just seeing people as people. And going back to that issue of race is that there's no scientific evidence that says that because I'm African American, because I'm Latino, then these things are present that's different. And when you sit in those college courses, you will see that the morbidity and mortality, a lot of the those emerging doctors are taught that um, the compliance for African Americans are lower, that they're automatically going to present with these certain illnesses, whether it's hypertension, diabetes, and things of that nature. And so we have to think about how we're educating doctors and that everyone deserves that value of time. Oftentimes, you'll hear doctors say, well, I'm not going to spend as much time on this patient because they're not going to be compliant and they're not going to listen to what, I'm sharing with them. And so why, spend the time that I'm spending on other clients. But that is how institutionalized racism really works, in that it starts with those ideas and it starts with those frameworks around how we're going to treat people differently. And we have to think about compassion, and it's really simple. Treat people how you would want to be treated. Treat people how you would want someone to treat your mother, your sister, your brother. And start from that framework and recognizing that, yes, we understand that the healthcare system is a very stressful, environment. There's a lot of demands that are on physicians and healthcare providers. But at the very basic, bare bones is, treat people with dignity and respect.
Okay. How closely does the Black Healthcare Coalition work with not only the Kansas City Health Department, but the health departments in the surrounding suburbs?
Yes, so we do a lot of outreach to the African American community as it relates to public health programs, whether it's vaccination programs, where we did a program with the Jackson County Health Department around HPV vaccination, the Community Health Improvement Plan with the City of Kansas City's Health Department. Several years ago, before I became a city council person, they focused all on social determinants of health. It was like a groundbreaking piece of what they've done that wasn't being done across the country. Instead of looking at like how do we address heart disease and reduce morbidity and mortality around diabetes and heart disease and those things, how do we address the conditions in which is causing the heart disease? And so we worked a lot around the social determinants of health with them. With the Wyandotte County Health Department, we did a fabulous smoking cessation program with the local pharmacies that were inside of the um, grocery stores. So, like the Price Choppers and things of that nature, we will put a community health worker there and ensure that they had access to smoking cessation, free smoking cessation, which was a wildly successful program. We worked in barbershops and beauty shops and bringing public health messages out to the community. But that trust is so important, and the Black Healthcare Coalition is often seen as a trusted partner. We're working on COVID right now with doing COVID is real in terms of a messaging campaign and getting social media influencers to talk about the importance of protecting ourselves against COVID and getting the flu shots and things of that nature. So the public health system is a critical, as it relates to public health departments, are critical partners because they provide the evidence and the information that we need to package it to the communities, and so that it is digestible and is culturally relevant. We also have doctors on our board and nurses and things of that nature to help us out with that.
Okay. Here's a question. How can the city shift its emphasis from developing downtown to developments in the third and fifth districts where there's so much need?
Absolutely. I take a look at 200497. I introduced it on June the 23rd, and I'm still hanging on. But essentially, what that ordinance does is it exempts, and so it says to developers that we will give you a basic level of incentive. And there's a committee sub that may not be uploaded yet because we've just been working for changes for compromises. But it essentially says that we will give you a 10-year abatement at 50% of the level of abatement. Abatements right now, they go up to 75% and up to 25 years. And so if you want to develop downtown or wherever, then you get a lower abatement from the start. However, if you decide to do development in historically disinvested census tracts, which are in the third and the fifth district, if you decide to do development in our prioritized areas, whether there's opportunity zones, our enhanced enterprise zones, and which are pockets across the entire city, not just the third and fifth district, but there are pockets up north, there's pockets, but these are priority areas that lack investment within the city, then you can get the full incentive. And oh, by the way, we're in a housing crisis. And so if you do housing development that has at least 10% of the units that are at the 70% median family income as established by HUD, and you do 10% of the units within that same development that's at 30% median family income, you have 20% set aside. Oh, we'll give you an additional incentive. You can get the full incentive because you're working on our priorities. The last priority that's in that legislation is for living wage jobs. If you bring a job anywhere in this city that has access to mass public transit and it has to be more than 100 jobs, but they're entry-level jobs that pay between $32,000 and $45,000 minimally, you can get the full incentive. So, I mean, for me, it's not rocket science. It's like these are the things that we need within our city, and we're going to incentivize development to do these things in these places. However, there's a lot of pushback, obviously, from developers and people who feel like that it would inhibit growth within our city, and that we would go back to the Mark Funkhauser days of where there was no development in the city.
Melissa, we have a lot of students who are on this Zoom call, and I guess I want you to address how you didn't just happen to awaken one day and decide that you wanted to be a school board member or a city council member, but that you actually were groomed from the time that you were a teenager on through college and afterward to be in the position that you're in, and how young people on this call can think of themselves as being the next you.
Oh, well, definitely I would discard against that. But I would say is that I would encourage you to dissent. I would encourage you to open up your eyes and look around you and to see the challenges that we're faced with, that you're faced with, that your children are faced with. I didn't join the school board because oh, I just didn't have anything to do. It was because I could not, even though despite Louis Duguid's wonderful book that I've read several times around parent empowerment, and if you have an empowered parent, then I just couldn't I didn't feel comfortable in putting my child in a school that was in my neighborhood. So instead of just complaining, I said, well, what can I do to get in there to make it different, to make it better? So not being on the sidelines, get in the game. Yes, you're going to take a lot of hits and it's going to be challenging and difficult, but just look around you and see what is the change that's needed, and begin to share that change, build your voice. There's a lot of protesting going on that I will protect, that I will support, but we have to also move from the protests to the policy. And it is a gap. We need to talk to our professors and the people around us that understand policy to say, hey, I have this idea, but how do I change that idea into an actionable thing? And that actionable thing is not something that I'm going to do in a petri dish, because a lot of times we have a lot of programs and they're like little things that we're doing and they're good and they're making change and that's great. But unless we address things from a policy level, we can't make things better for everyone. And so I did mention the Crown Act, but that was also something I co-sponsored around African American hairstyles and making sure that we are not discriminating from an employment perspective on things around hair, natural hair. And so I could just say, okay, I'm going to work, within my company or within my organization not to do this. But the fact that we made it illegal for you to discriminate, against people, that's a huge policy shift that changes the game for everyone. And that's what we have to start to think about. It's like, how do we do this so that we can create systems change? But I'm not an anomaly. I'm just, someone who looks at people like, Mr. Do Good and say, hey, can you tell me more about this? Can, we sit down and have a conversation and to learn, but then also to act and to be willing to fail forward and to be willing to mess up. But also just always rooted in, I'm trying to do good for people. Um, so we'll see. I'll be here for the next couple of years, but we're dredging up a lot of things, and we have to work from a place of urgency. So
Councilman Robinson, you had mentioned efforts that are going on in the third and fifth districts, but I guess I want to throw a Hail Mary pass out there and see what might be possible here. We've seen that the streetcar is being extended to the Missouri River. We've seen that it's being extended south to connect with UMKC and students there. But I wonder what might the possibility be of a spur that goes from Union Station to Prospect, so that the east side is connected, so that the 18th and Vine district is connected. Like I said, just dream with me here. What might be possible there?
Absolutely. I am dreaming with you. We need a east-west route. God bless Mayor Sly James for his efforts. They came up short when this first came online to do an east-west route down Linwood. But that's not lost. I am definitely a proponent of looking at like Independence Avenue, or looking at 18th and Vine, or looking at places in which we can do an east-west transit. We do have zero fare, and I use the data from the streetcar to help us to lift up zero fare, because, you know, from again, a systemic racial lens, all the rich white people were riding the streetcar for free, but all the poor Latino and Black people have to pay to get to work to on the bus. So how do we balance that scale? And so I think, you know, making sure that that we have a free bus system that connects people to the line that we have now and that's being developed is critical. But the next step of phasing, which is a lot of money to do another route, but we are definitely looking at, and not just myself, but other people in the transit community are looking at east-west routes.
Okay. Um, Several years ago, Oliver Gates, who's with Gates Barbecue, proposed a sales tax exemption for the 18th and Vine area, and then on south to Linwood and so forth. I guess I wonder, is that an initiative that would have to have the state take action on that, or is that something that the city could do? And how would it help those areas?
Yeah, I would definitely have to talk to legal. I think that it would be huge as it relates to a place of destination, but we also have to have the right programming and the right businesses to make sure that that was effective, right? Like ensuring that, you know, we had a convenience store, you know, somewhere where, you know, people can, whether it's a um, Walgreens, or a small market of grocery, making sure that we have the right types of development, because right now it's an over dependency on entertainment and restaurants, which, you know, is good. It's one piece of the pie, but we do have to build out additional opportunities for economic growth in the area. So I think that that would be great if, and we actually in the 18th and Vine, it wasn't a sales tax, but we had a TIF district as well, but it wasn't throwing off enough economic activities for it to be meaningful. When you look at a community improvement district in which we tried to support, not a lot of throw off of cash because of the programming that's down there. And so one of the things that we've done, that I led the effort on, getting a master developer for 18th and Vine. So we are able to choose two master developers, one for the Boone Theater and another for all of the other city-owned property at 18th and Vine, and they'll be tasked with the right complements of goods and services to really make that district go, and to make that district grow. But that's something for us to think about, and I'll have to do some research and get back with you on if that's something that the city can enact as it relates. I know we could do earnings tax, which would be great, right? For that area, for the actual businesses, to exempt them, which we redirect. We're getting ready to pass. We're getting ready to do an election to pass the earnings tax again, which I hope everybody will vote for. However, in the same breath, we do a lot of earnings tax exemptions and redirections that we have to take a look at as well that are not typically Easter truth. So I'll have to research both of those. Thank you for those good ideas. See, when you hang around Louis Do Good, what happens?
I want you in the last couple of minutes that we have to think again in the framework of equity and parity and social justice and peace. If you had this wand and could wave it and get the city to do X, Y, and Z, what might those three things be?
Wow. The first thing would be a commitment to racial reconciliation, a thorough, comprehensive commitment that, touched all of our particles, if you will, to racial reconciliation. The second thing would be around investment. I would want us to put 1% of all city revenue into violence prevention activities as it relates to economic mobility, parenting resources, things of that nature, things that actually prevent violence. And I would want us to look at, again, from an equity lens, how is it that we are applying the resources, every resource, whether it's our GEO bond dollars, whether it's the economic development incentives, which, by the way, we lose $100 million of city money a year on incentives. But all of those revenue generators for the city, how are we reinvesting that into our most vulnerable parts of our city, the parts of our city in which needs open heart surgery right now, immediately? How do we ensure that those parts of our city are adequately resourced? So those would be my three things off the top of my head.
And I want to thank everyone for being here today. Let's give Councilwoman Robinson a big hand, everyone. Terrific presentation. We appreciate all your efforts. To my students, class begins in about 1 minute, so get on the other link. To everyone else, thank you for being here today. Take care.
Right.
Thank you, Councilwoman Robinson. Terrific.
Thank you so much.